warm welcome from Geneva, Switzerland. This is Rida Satki. So this is the Impact Accelerator Week 2 in the Scholar Peer Hub. This is the 28th of September, 2020. Very pleased to welcome you here. Today's General Assembly is not being broadcast on Facebook. We want to really focus on working internally with the participants who have committed to going forward with the Impact Accelerator Launchpad. So we asked you a very simple question. You developed an action plan. Are you ready to take action? That is what we asked you, and you'll see an impressive number of participants answered yes to that question and have already started. Now, a reminder, there are 4 pillars. You made the pledge when you applied for the COVID-19 Peer Hub. It's really that commitment to achieving impact. Last week, you did the first measurement, so you actually declared, set a specific objective, determined what you were going to focus on in the next 7 days, and have been taking that forward, and we'll be reporting back on it before the end of this week. The share pillar is actually what we're doing today in the General Assembly. So really sharing of experience, sharing successes, challenges, lessons learned, and the point is to get us to mobilization. And that is the key, in fact, to the accelerator. It's not about learning. Learning is the means to an end. The goal is actually to get to build momentum, to use the power of the network, and to overcome difficulties and to leverage the resources that you have, including those you may not be aware that you have. Last year in the first accelerator, basically everyone who joined recommended participation. And if you need something more tangible, more concrete than that, well, here it is. On the far right, you can see 44% of people who did not participate in the Launchpad. So we asked these questions, same set of questions, to people who did and people who did not participate in the accelerator. And almost half of those who didn't participate did not do anything. We're not implementing their course projects 6 months later, the projects that they had developed, the peer-reviewed creator projects. Conversely, those who did participate in July 2019, well, you can see a third of them were making progress with their course projects as an individual project. 1 in 8 were working on a group project, and half of the participants who responded to this 6 months later were working on a country project. That is indeed an impressive result. What is the Accelerator? It's a human knowledge network. It's what we're doing today by sharing experience. A reminder of the schedule as well. We're in the green column here on acting, monitoring, and sharing. So really, reporting your progress is the main thing we're asking you to do. These Monday meetings to share, and then reporting on your progress is how you stay in the accelerator. Now, what's remarkable is that we had, as you know, 338 people from 39 countries who earned a certificate for exercise 1. Now, 85% of you, so 287 from 27 countries, have joined the accelerator. You can see Uganda, Zambia, Zimbabwe. Now, you'll notice that many countries have 1 person. And one of the things I was thinking of, I think we need to discuss this as a team, but would welcome feedback from you, is maybe to get those individual participants from individual countries together and see if maybe they can do something together. In any case, we appreciate that effort and the commitment that you are making. But it's remarkable that 15% of you, no doubt for legitimate reasons, very busy. Your action plan wasn't quite what you actually need to work on or prioritize, whatever the reason may be. Still, 287 people are in the running for the Impact Accelerator. So we had a couple of people who actually filled out the Accelerator Launchpad and told us why they couldn't join the accelerator. That's much appreciated. And then most of you, but not all of you, are going to use the action plan you developed in exercise 1. I thought that was interesting as well. Some of you are going to work on your Teach to Reach Level 1 projects, and then your GRISP and data improvement projects as well. Now, this is an important slide because it shows that right now, 63% of you say that you have already started to do something with the action plan. This is for the anglophones. It looks actually quite different for the francophones. Now, a third of you completed your action plan on the 4th of September, right? At the end of the 4 weeks. and you haven't done anything with it. So that's a third of you. But hopefully by now, by setting a specific objective and identifying exactly what you said you would do last week in the coming 7 days, you'll now be able, on the second report or monitoring Peer Hub reports for the accelerator, you'll be able to report back that you've started. So that is one of the things we'll be tracking. Now, for the 9% who have finished, so here we're actually going to be inviting that 9% who say they have already completed what they wanted to do with their action plan so that they can share their stories. There must be some interesting stories there. What you said, most of you, more than half, are working on what should be called a short-term project between 1 and 3 months. I wonder if we shouldn't have been more granular and ask, does anybody think they can do this in less than 4 weeks? Again, the point of the launchpad in the accelerator is not to think or assume that you're going to implement and complete your project within 4 weeks. It is to deliberately focus on actually making progress, figuring out what actions you're going to take next, and learning from the successes, challenges, and barriers, as well as lessons learned from other participants. But overall, most of you, and this makes sense in the COVID context, are working on short-term projects. In terms of the thematic areas, so we use the same 7 categories that from the ideas engine and from other surveys based on the aligned to the WHO Pulse 1 survey. You can see those categories here. And so not overwhelmingly, or not as overwhelmingly as with the Francophones, you have 36% of you who are working on demand. Second is health worker safety. Third is catch-up. So you can see the numbers here. And then 91% of you say that your project is integrated within the broader EPI program. That's very important. And we're actually going to be reaching out to the 9% of you who say that's not the case yet to understand where is the problem, because we want and consider that for a country to make progress, that has to go through the EPI program. So whether there's special circumstances, we know some of you are not working, your official or formal role is not related to immunization, but we'll try to figure things out there. So I want to go to Dr. François Gass, who is with us to comment these numbers for the anglophones and what you told us in week 1 of the Impact Accelerator. François?
Hi, Reda, and hello to all who are today on these hours of sharing experience and results and progress. I would say that my first impression is that there is an enthusiasm to implement the project that have been developed. Either this project was part of the EPI continuity plan, but get a bit maybe more specific in the action step needed to be implemented to address the challenge they face, or just a new project that go beyond the recommendation they receive from their national level on how to address the negative impact of COVID. And this, I think it's a very interesting to see that people are committed to pursue what they have developed and try to achieve results. Now, I hope that I am looking forward to see how specific are your project and how detailed are your actions to address and overcome the problem you face and achieve results you can monitor. So looking forward to the shared experience. Over to you, Reda.
Here we go then. What we first want to work on is to look at the objectives for projects. So remember, we asked you to sum up what's your project about, tell us what you want to do and how you want to do it. Second, we asked you to set a specific objective for the 4 weeks. So something that you can get done in 4 weeks, and at the end of the 4 weeks, be able to measure and tell how you've done it, whether or not you've been able to do it. And then we also ask you to tell us what are you going to do for the next 7 days that will help you reach that. So what we would like to work on is looking at some of these objectives, and I'll let you take in this one. This is where we're going to look for volunteers. So I'm going to lower the hands that are up now. And really, so this is someone who said that their challenge is on demand. Project summary is to create demand for immunization through door-to-door mobilization by community health workers. So there the activity is pretty clear. But the specific objective to be achieved in 4 weeks is increasing immunization coverage. So I'd like you to think about that. And if you can see a way to suggest to the author of this objective how to improve this objective, then please raise your hand and make a suggestion, propose how this objective can be improved. If you think it's a great objective and specific, then please say that as well. All right, and we're gonna let's have some music while you think about this. And whoops, yeah, here we go. All right, and as soon as you have a suggestion that obviously should be constructive and really, again, tell us how you would rewrite this to improve it, to make it better. Again, it's an objective to be achieved in the next 4 weeks. Please raise your hand so we can open up your microphone and you can tell us. You can also write in the chat if you don't feel comfortable speaking or if you have a problem with your headset. And until, okay, okay, wonderful. Let's go to Abdullahi Balarabe. Abdullahi?
Yeah, good evening, sir.
Yes, good evening. Welcome.
Good evening, everyone. Yeah, I think the best way to write this objective is to say we want to increase immunization coverage by so percentage. You need to create an objective that is
Abdullahi, you're breaking up. I don't know if it's just for me, but I'm not able to hear you. Please, what would you suggest? How would you suggest to rewrite this objective? All right. Unfortunately,
objective is not clearly defined.
Okay. So yes, I agree. It's not clearly defined. Can you tell us what would you suggest to make it to more clearly define it?
Yeah, I suggest that maybe the percentage of the immunization coverage in the area where this person operates. Let's take for instance, maybe is 70%. So the best way to write this objective is to say I want to increase it by 20%, making it 80.
Right. So you would add sort of numbers, indicators to show what change you would want to see, you would expect to see within the. Do you think, Abdullahi, that's realistic within 4 weeks that you would see changes in the actual percentage of coverage and would be able to measure that within a very short duration?
Yes.
Okay. All right. Thank you, Abdullahi. Let's go to Subhadip Bunya. Whoops, I just muted you. Didn't mean to do that. Yeah. Go ahead, please.
Yeah, good evening. Can you hear me, sir?
Loud and clear.
Okay. Basically, in my view, the next 4 weeks, it will be very difficult to measure the immunization coverage, increase in the immunization coverage, because that will be too short a time. Hopefully, if we can give it a 6 months time or 1 year time, that will be much more realistic. So in my view, that will be the specific objective can be in a different way, like training of the vaccinators. Number one, it can be done. Next, training of the mobilizer. Most important part of this demand is mostly the mobilizer training. If we can train the mobilizer, then it will be very helpful. So if we can measure that how many mobilizer has been trained or how many mobilizer are not trained, and then within 4 weeks we can train them, and then we can measure how many mobilizers has been trained, and so that the beneficiary can be taken. Beneficiaries can come to the immunization session site. So that will be, in my view, that will be measurable within next 4 weeks, sir.
Okay, thank you, Subhadip. Let's go to, all right, I see many more hands raised. I see some great messages in the chat. Dr. Isha Goyalo, great suggestions. This objective can be improved by being more specific for 7 days, like we'll design microplan for door-to-door survey in the next 7 days where area and workers are mentioned. Let's go to, let's go to Loretta Awokme. Loretta, are you able to speak to us?
Yeah, Reda. Hi, everybody. Good evening. Good morning.
Welcome. Please go ahead.
Can you hear me? Okay. What I wanted to add to this specific objective is he should, because objective is actually breaking down the main challenge, which is, she could just say, I'm going to increase immunization coverage by training vaccinators or mobilizers or community health workers or people that are maybe the caregivers, maybe, to make them understand that they need to take their children or their wards to the clinic for immunization. And also the specific objective also could be ways she feels, well, one activity she feels she could also do apart from the training or the mobilization. It could also be maybe taking a key message to maybe just the community leaders, if she feels that the community leaders have influence, on their community people. So it could be just taking key message to the community leaders in form of advocacy and telling them, this is why I need your people to go to the clinic for immunization. So she has to specify exactly the activity that will lead to this increase in immunization coverage. She has to specify that.
All right, thank
That's
you.
what I need to add.
Thank you, Loretta. All right. Let's go to the next example. Whoops, there's also a spelling mistake. Okay, so this one is also on restoring demand for vaccination. And the author summarized their project in this way: addressing demand creation and reducing vaccine hesitancy. So already we can see this doesn't tell us very much about what exactly they're intending to do, even though we can assume that this they did explain in their action plan. So maybe they were in a hurry, but let's look at the specific objective in the next 4 weeks. So instead, the author writes the overall goal, which is not what we were asking, is to create demand for vaccination and address unmet needs. Okay, so let me just lower all the hands, and if you'd like to make suggestions on this one. Now, the next 7 days, it seems like everybody gets to ensure weekly meeting action points were well followed up based on my proposed action plan. So that's more concrete. Let's go to Shola Oyeni. Shola Oyeni. Please go ahead if you'd like to unmute yourself. I've lowered all your hands, but if you'd like to raise them back up, if you have comments on this one, again, I'll let you, I know you need time to actually read, especially if you're on your phone. Let me see if I can paste this into the chat so everybody can see it. All right. Maybe you'll... Oh, okay, they're there. All right, so Heaney says, I like the questionnaire by narrowing from 4 weeks to 7 days. It immediately made me realize it's important to think in terms of subtasks rather than a full-fledged project management. All right, so we need at least one volunteer. Okay, Mohammed Imran Qureshi. Imran, would you like to share with us your comments? How would you help your colleague who has defined this as their specific objective to be achieved in the next 4 weeks?
Thank you very much, Reda. I guess the most important component as far as program is concerned is demand generation. And the most unmeasurable, or I would say like difficult to measure, is this demand generation and communication aspect of the program. So this is really important. That if it is a most important component and you are unable to measure by some statistical analysis, then probably you have to set certain goals so that you could achieve all those objectives, which are the bigger goals. In my understanding, the first and foremost thing is basically this COVID-19 has resulted in concerns and questions in the mind of the parents. So until the time we address all those concerns and questions, there would be a gap between the service delivery and the service availing opportunities and the proportions. So like client satisfaction, we started in one of the way we were like making a robocalls after getting a random sample to the parents, and were collecting their response, how much they were satisfied from the services they received. So this could be a one way. Like in that way, like we can set the baseline and then can set a target to be achieved in a 4 weeks time. In that way, probably we could like figure out how much we have improved the aspect of demand generation. And there are parallel, a lot of activities are being conducted to address this challenge of demand generation, developing the appropriate tools and materials for the community. And then various medias are being used, social, electronic, and print media. So in that way, like the program is already putting hard efforts to restore the demand generation for the vaccination. But yes, its measurement would definitely be a challenge.
All right. Thanks, Imran. But so I'm going to challenge you a little bit. Can you propose a specific objective to be achieved in the next 4 weeks with the information that you have on the screen, which I realize may not be, may not vary very much, but in line with what you said about the change in perception from caregivers, the change in that relationship. What would you propose to this author? Very concretely.
Rida, I believe that, again, I would say it's a really unmeasurable sort of a thing. So it depends, like how much is the baseline and how much you want to improve this component of the program. So for that reasons, you could have a smart survey. You can conduct a smart survey. Like I gave an example of client satisfaction rate, which we already use in our setup. And then we can like set a target after establishing a baseline. And from there on, how much are all the strategies and activities are giving us a result. So in that way, we can measure this component as well. Over.
Yeah. Thanks, Imran. That's. I thought that your mention of a customer satisfaction survey was interesting. I take note also of the great comments in the chat. Some really detailed and specific comments. Let's go to Emmanuel Udochukwu. Emmanuel, are you able to speak to us? Please go ahead and unmute. And then we have Shola Oyeni, who was trying to unmute before, who couldn't do it. If there are further comments on this one, but I agree with Imran, this one is difficult. And then we'll go to, we'll look at one more, and then we'll go to Francois for a recap and some comments. And maybe we'll also ask Alan Brooks if he's game to give us his feedback on what goes into writing a good specific objective with a C before the T. So the third one is challenge of health worker safety. The project summary, the author summarized their project in this way: develop daily routine vaccine restoration to adapt fully recovery. And the specific objective is focus to receiving material and ensure health worker safety during immunization session. So if either Shola or Emmanuel would like to unmute and comment on this one. Otherwise, this was not the one where they raised their hand. So please, we need at least one more volunteer who can respond, analyze this one. What do you think what would you, if your colleague comes to you and says, this is my specific objective, can you see any way of helping him or her improve that objective? All right. And Dr. Isha Goyal says, for next 7 days, we can be specific, like designing message and form of message or pamphlet, which has to be communicated. All right. Okay. Janada Dimas. Yes. And I'm always happy to see someone who, perhaps someone who's not as, who doesn't find it as easy to speak. Janada Dimas, welcome.
Yeah. So good morning, good afternoon, good evening, everyone. My comment would be that with regards to the specific objective, I think there are two main issues that are different. There are two different issues. First of all, I would advise that it also streamlines the objective to only one, and then make it measurable, just like the last speaker, Imran, mentioned that the objective needs to be measurable. Let's know what we're actually targeting And then I don't know if I could comment on the challenge, but the challenge is only talking about health worker safety, while the objective is talking about receiving materials. So I think some work needs to be done with regards to the objective to make it focus on only one main issue.
Great.
And it should be related to the challenge.
Yep.
Thank you. Over.
Thank you very much, Janada Dimas. Let's go to, let's see, looking for voices we have not heard before. Let's go to Obed Nuobe, whom we have heard before, by all means. But always a pleasure, Obed. What would you like to say about this one?
Yeah, thank you very much, Rita. Good afternoon, good evening, everyone. Rita, if you look at the challenge before us, the health worker, they want to provide probably PPEs or something for them so that they can be able to continue the EPR services. So we should know the number of health workers that lack these PPEs, for instance. I'm narrowing down to PPEs because I've seen receiving material. Exactly, it will go a long way to ensure that they get specifically what. So for me, I would say maybe to supply 50% of health workers with appropriate PPEs from this period to that period by the close of this impact accelerator period. You just state period, maybe from 21st September to 21st October, you are going to provide 50% of PPEs to health workers who do not have them. Then specifically, you have narrowed your objective.
Great, thank you. Thank you, Obed. That's very helpful. I'm just looking up, trying to see where is, yeah. So just if you remember if you recall the sequence, and you're going to be doing this again this week, you summarize your project. You summarize your entire project. Now, what is a specific objective from your thematic area that you want to achieve in the next 4 weeks? And there's no need to repeat the thematic area because you already gave that to us. In a single sentence with an action verb, describe what you will focus on in the next 4 weeks. And then in the next 7 days, what is the most important action that you're going to carry out? So that those are 3 examples pulled from the full set of objectives. And if you realize now that you could be more specific about what you want to achieve in the next 3 weeks now, well, you get a second chance because we're going to be asking you, remember, the only condition for staying in the Impact Accelerator is to complete the weekly report updating us on your progress. And we'll be sharing the full report so you'll be able to look at everyone else's reports, and maybe that will be helpful for those of you who have time to do that. I'd like to go to Alan Brooks, if he's so he was not warned, but because he's here with us, he is a member of the International Advisory Board that is helping us with the Peer Hub. Alan, what would be your comments or advice to scholars in the Peer Hub who are, some of whom are, struggling a little bit to zero in on a specific thing that they can achieve in the next 3 weeks now?
Thanks, Rita. Yes, this is Alan Brooks, and I really concur with a number of the comments also that have just come in, and including keeping it fairly simple and sort of single focus in such a short period of time. As one person noted, the last objective we looked at, for example, had two elements of it, and as one of the comments brought forward as well. It wasn't as smart as it could be, meaning it wasn't as measurable in terms of some of the actions. So keeping it very straightforward in terms of simple and single-oriented and measurable will take you a long ways towards those individual steps, each of which, though, take you down a very important path towards the impact you're seeking to have. Over, Rita.
Thank you, Alan. Now, Dr. François Gass, you worked 4 days a week for for 4 weeks with some of the participants in the Peer Hub. What would be your comment and advice in terms of what's the best way to zero in on something you can actually get done in the next few weeks?
Thank you, Reda, and I'm glad to see so many people attending that session. And thank you for sharing those experience. I believe that many of the comments, like Alan said, many comments are right to the point. To have a realistic objective over a few weeks, to have a quantified objectives that you can measure at the end of the 4 weeks to say, I have achieved it. And so we want to see some figures in the specific objectives. Something I've noticed as well, nothing prevents you to have an overall objective being very specific. If you look at demand, you could say, my first dose of pentavalent vaccine will move from X to another number Y to another figure over 4 weeks. And it depends where you are. If you have an overall objective for the country, it will be very difficult to move fast that objective. If you are in a health center, in 4 weeks, you can do a lot to show that the attendance is measured by the number of women who come for Penta 1 and return number of women improving and returning for Penta 3, which is a decent objective. And I think going back to the one on safety of workers, I think I concur also with the objective, and nothing prevents you to have an overall objective and below an objective for certain number of concrete action you want to carry out to achieve the overall objective. If you want to have all the workers with protective equipment, you could say, I'm going to write, my first objective is to contact whoever you have to contact, NGOs, to get a support for getting the material, or my government. This is a concrete task that could be an objective. You could have an objective to train all your workers to be how to use and make sure they use. And you could have an objective said at least 80% of my health facility will have the required equipment after 4 weeks to protect the health worker against any contamination by COVID. So try to be as quantified as possible, as specific as possible, either in your overall objective or in the action you're going to take to achieve the objective. Because I'm sure in your plan of action, you have a list of action, and it can be a certain number of visit to community, visit to health facility to monitors that the health worker have now the equipment and are using it. So be as specific as possible. SMART has been pushed. It's sometimes very difficult to translate your objective and action into SMART ones, but I think it's very important to do it when you revise a bit your project and you do something that's realistic in the 4 weeks to come. Thank you. Over to you, Reda.
All right, next we have experience sharing, which is at the core of the Peer Hub. And I was not disappointed, but I was surprised to see that 70% of you did not have anything to share. Now, some of you might have been in a hurry, knowing that if you say yes, then we ask you additional questions in the questionnaire, and you're going to get to do this every week. So that's fine. We still have an impressive number who shared barriers, lessons learned, and success stories. I want to turn to Shalini Kare, who sifted through all of the experiences shared. And Shalini, could you tell us what you have pulled out and why of the 27 countries there are only a few of them represented in what you've compiled today?
So, hi, Reda, and hi, everybody, and good morning and good evening and good afternoon to you. The projects that I went through, I found that there were some who had very specific objectives which were measurable, and they had included some data. So that was the rationale behind selecting the projects. It was entirely unbiased and based on how measurable or how their action points could be achieved in the next 1 month or within the next this month. I mean, 1 month. So that's how I analyzed and selected the projects.
Okay, great.
Thank you.
Thank you so much. All right, so let's dig in. The first one is from Simon Aeji from Ghana, and unfortunately he is. Let me see if he is in the room. So Simon. Yes. Okay. All right. So Simon, I've activated your microphone. So this may be hard to read. I think the text, there's probably too much text for a single slide. Simon, so you said you had a success story to share. You are from the Bolga Municipal Health Directorate in the Upper East region of Ghana. Project implementation is ongoing. Focus was on house-to-house vaccination for the dropouts and missed beneficiaries. So tell us, Simon, welcome. Please introduce yourself and tell us what happened that you decided to share with fellow members of the Peer Hub.
Hello, everyone. Good morning, good afternoon, good evening. I'm Simon Aeji from Ghana. My thematic area was looking at the catch-up, that is plan and manage effective catch-up strategies. And this project was developed during the Peer Hub. And the intervention area is Bolga Municipal Health Directorate in the Upper East region of Ghana. In terms of implementation status, the project is ongoing. And for the implementation, the estimated time for implementation is between 1 to 3 months. And we want to start a program on the 30th of September to 13th of October 2020. And as part of the implementation, we also want to do a post review on the 17th of October 2020 to actually look at the status of implementation to see what we really want to do. In terms of the project itself, realize that because of the COVID demand for immunization, most of the people are not coming. And as a result of that, we realize that our immunization coverage has actually gone down. So we actually intend to do a house-to-house vaccination for dropouts and then missed children. We have 9 sub-municipalities with 85 communities, but specifically we want to concentrate on 35 of them. We've actually done training, a one-day training for all the vaccinators. We're actually looking at 27 vaccinators with 9 team supervisors, and these supervisors are coming from the district. And because of the scope, because of the communities are large, and I must point out that we actually did not zero in to know the houses that will be visited, but we intend to use the 35 communities that we want to enter to basically look at how many houses that will be actually be able to cover. So we've done training, we've also done engagement with the facilities so that they'll be able to support them. In terms of our outcome indicators, we want to, like I earlier on mentioned, we have 85 communities, but we want to look at 35 communities. So in terms of our outcome indicators, we want to know how many communities out of the 35 that we want to do, how many have been reached, and also to know the number of houses. But in terms of our key indicators, we want to look at Penta 3 and then MR2 is very key in measuring our EPI services. So at the end, we want to see how many people have been vaccinated as compared to the targets that we have. Currently, for half year, our Penta 3 stood at 47%. So we are hoping that after the exercise, we'll be able to measure and look at what we've been able to achieve. Specifically for the next 4 weeks, we want to do house-to-house vaccination in 35 communities in the Bolga municipality. Then for the 7 days, we want to distribute vaccines and then reporting tools. And I must point out that my other colleague, who is Ibrahim Mohammed, who is also on this Peer Hub, as part of his project, he is focusing on ensuring healthcare safety. So we trying to team up so that he'll be looking at making sure that all the vaccinators and the supervisors have adequate PPEs, nose masks, sanitizers to be able to make sure that we don't expose them to the infection. And in terms of the success story, Reda, I want to point out that it has been very impressive. After the project, I discussed with my municipal director of health services, and I also spoke to the EPI coordinator, and then we had a stakeholders engagement with all the sub-district leaders. And as part of my project, there was a budget that we did, and we actually budgeted for 6,482 Ghana cedis. And I must say that that amount was granted. And we are actually the sub-districts that we have are going to fund it. And all the monies for both for the vaccinators and the supervisors have been provided. And I must say that even today, we had a meeting with all the vaccinators, and by tomorrow, we make sure that all their TNT and then their fuel and all the necessary logistics will be given. So that is what I want to say. Over to you, Reda.
Thank you, Simon Ajay. Quite a lively discussion around the differences in practices from one country to another going on in the chat. And some important considerations shared by Carolina Da Navarro from the headquarters of the World Health Organization, who reminds us that WHO doesn't recommend gloves for vaccination. Let me see if I can pick up the most important points. In some countries, house-to-house is commonly used, but they take safety measures very seriously. This was in response, house-to-house vaccination policies vary by country. Let me just see if we can just ask Carolina to summarize the key points. Carolina, are you able to come in? Yes.
Yes, thank you. I have to double check in COVID times, because normally we don't recommend gloves, but somebody's mentioning that now it is. So let me check and I'll get back to you. House to house, it's a strategy that many countries use, but you have to take precautions for make sure that vaccine safety, cold chain is maintained, and also that people know that they have to come back to the health facility. Thank you.
Great. Thank you, Carolina. All right. So very impressive. Also, in terms of resource mobilization from Simon. Thank you very much. Please address your additional comments or questions to Simon in the chat. We have Shalini selected 1, 2, 3, 4, 5, 6, 7, 8, 9 out of the 32. So it's quite a hefty task sifting through everything you're sharing. But what we're going to do for the first time is share with you the full Excel sheet of all of the inputs, all of the challenges, successes, and lessons learned that were shared by members of the Peer Hub. Now, you may not have time to go through it, and that is understandable, but that's certainly what we're going to make that available for those of you who'd like to go further. So Modupe Orolugbagbe is connected twice over. So let's see, Modupe, if you're able to. I've allowed you to unmute on both of your accounts. So please unmute just the one where you have your microphone connected. Your thematic area is on restoring demand for vaccination. You work in Lagos. And project implementation is ongoing. Now, a specific objective, again, this may be, is reinforcing behavior change among caregivers, allaying their fears around contacting COVID-19 while visiting health centers. And then you have a success story that you would like to share with us. And let me be relative about what that means. It means you made some kind of tangible progress that you want to share with members of the Peer Hub. It is not boasting or bragging in any way. So some mothers, that is one per ward, whose children had completed their immunization, were declared as immunization champions and were named as role model caregivers. Modupe, welcome. We'd love to hear the story firsthand from you. Tell us what happened, what was your role, and what changed as a result.
Good afternoon, good morning, good evening. My name is Modupe Orolugbagbe. I'm the Health Promotion Officer, Lagos Island Local Government, Lagos, Nigeria. In the course of the pandemic, the COVID situation in the country, we observed that most of the caregivers were afraid of coming to the health facility because they're of the opinion that they will catch the virus if they come to the health facility. And due to my role, my job description as a social mobilization officer of my local government, we with the LGA team, we call ourselves LGA team, which comprises of the medical officer of health, the head of the nursing services, the local immunization officer, the cold chain officer, the head community health officer, the MIE, because we need the data to really know. Prior to the commencement of my activities as a social mobilizer, we observed that our coverage, immunization coverage, stood at 35%. And usually the first step we did was to engage the community. You cannot do it. There must be community participation. So we engage them. Thereby, then we use community mobilizers, the traditional announcers. They go around encouraging, giving out key messages. And in the course, of about 3-4 weeks, we're able to identify what we call role model caregivers. Those are mothers. Those are mothers that have had immunizations, whose children's immunizations are complete. They were able to encourage the other mothers on the benefits and importance of taking immunization, most especially during this COVID, because we don't want post-COVID that we have a situation on our hands. And also with the role of the World Health Committee, we use World Health Committee in Lagos and Social Mobilization Committee, which are members of the community too, different groups. We have women leaders, we have TBAs, we have youth, different groups. So we're able to see that there's slight improvement. Though it's still ongoing, we are looking towards about achieving 85-90%. Well, currently we're at about 73% coverage. Thank you. Over.
Thank you, Modupe Orolubagbe from Lagos, for sharing your the results of this effort. Let's go now to our next presenter. So Abdul Rauf Tahir from Pakistan. Let's see if Abdul Rauf, yes, is here. Wonderful. All right. So Abdullah, I'm asking you to unmute. Yes. Okay. So project is around health worker safety. Project summary: advocacy with healthcare professionals to adopt multi-pronged strategies, including SOPs, standard operating procedures for IPC, infection prevention and control, especially pertaining to delivery of essential immunization services. Specific objectives in the next 4 weeks: regular IPC assessment of health facilities and advocacy for COVID-19 preventive measures. Now, that's to set up the story that you'd like to share with us. More than 80 healthcare professionals. What did they do, and how did it turn out?
Thank you, Reda. Can you hear me?
Loud and clear.
Okay. Thank you for giving me opportunity. Basically, I am working as Divisional Service Officer, WHO DG Khat Division in the province of Punjab, Pakistan. And during the COVID-19, what I had the opportunity to interact with the healthcare professionals and the caregivers from the community side. And what I did feel while visiting the Tehsil headquarter hospitals, the rural health centers, and the district headquarter hospitals, that they basically, the caregivers from the community side, they were having some basically reluctance in having the essential immunization antigens. Secondary to some misperceptions among the lower strata, the misperception was that probably seeing the mortality rate of some patients in the community due to the COVID-19, they were basically having the wrong perception that probably the healthcare providers, they are administering some COVID-19 poison injections. So they were having this misperception. So when we visited the fixed EPI sites and when we monitored the outreach sessions, through the cultural, through adopting the cultural basically methods and having the support of some local influencers, we were able to basically to convince them that we are the same basically healthcare professionals who used to deliver the same antigens, essential immunization antigens before the COVID-19, and say these are the same dedicated people who are basically striving to get to basically vaccinate your children with the available protective equipments, PPEs. So there is nothing basically truth about the rumors which are spreading around basically through the social media. So you should come to the fixed sites, or whenever there is vaccinator in the outreach sessions, you should bring your children, and the healthcare professionals, they will definitely observe the standing operating procedures while administering the essential immunization antigens, and you will also observe. Regarding the Tehsil headquarter and the district headquarter hospital, during the last 4 to 5 months, what we have been practicing, that on a standard format, we have been assessing the infection prevention control at these sites. And we were sharing these basically infection prevention control assessment with the concerned stakeholders like the medical superintendents and the administrative staff, and with the higher ups, so that there are the healthcare professionals at these sites, they do adhere to the standing operating procedures. And for example, there is a screening center near the main gate, so that whenever there is a symptomatic patient or the patient with the cough and flu, so a mask is given, or mask is also given to the people above the 50 years of age, and all the healthcare professionals, they were also using the wearing the masks and using the hand sanitizers in the wash stations. They were also there. So through a collaborative team efforts in the outreach sessions and all the 4 districts of DG Khan division, and especially in the last week, I was in Laya for monitoring the polio supplemental immunization activity. We were able to remove some concerns from the healthcare professional side and remove some concerns from the community side. So what basically there are 2 districts in our basic region, basically whose essential immunization coverage traditionally low. So if we compare during the COVID-19 period from the start and the now, through our efforts and with the team efforts of the district health management team like the DHU preventive and the deputy DHOs, the district superintendent vaccination and the ESVs, we have been able to boost up the essential immunization coverage from 70% to 80%. And we are continuously sensitizing the healthcare professionals. We are continuously giving the orientation to the community people, using local social media, using basically our traditional style, or having the support of local influencers, so that our main objective is that we should reach at least 85 to 90% essential immunization, and hopefully within upcoming 1 month to 2 months, we will get this figure. Over to you.
All right, thank you, Abdul Rauf Tahir from Pakistan. Let's go now to let's hear from Alan Brooks, if you will, if he'd like to share any feedback on these 3 stories or has additional questions, and the same to François Gass. Maybe we'll start with François. Oh no, go ahead, Alan.
Well, sorry, Reddy. Just I've got a piano lesson going on in the background. Something we all share, the distractions, but just really appreciate the stories. And I think where I sometimes have to stop and ask myself is, the association of the coverage increase, what are all the drivers that are contributing to that, of which I'm sure these interventions are critically important. I'm thinking about how they are part of probably a number of other things that are going on as well to see that coverage increase and the type of impact. Really, congratulations to the presenters and the examples that they brought. Really concrete, and appreciate the thoughtfulness, the diligence. Over.
Great, thank you, Alan. And Francois, what are your thoughts as you hear these three stories that were shared? Stories of progress, stories of change.
I think, thank you, Reda. I think it's very encouraging to see success story and to learn from success story. We never learn, we focus too much on what doesn't work instead of focusing what does work. And I think this is an illustration of step taken, setting objective, putting action into place and getting results. And with a lot of details, of course, we are missing many details because the screen does not allow to go into all the details. And there may be a few things which are critical for just explaining the success stories that have not been shared but are in their project. Anyway, I feel that sometimes I found that in one case, which one, those countries, Simon, part of a country that usually does well, and it's a demonstration why they do so well, given the specificity, and which is, they always come with a lot of numbers to explain what they have done, who they were targeting, how they were targeting, and how there's outcome indicators, always number of communities, number of house visited, which I think make sure that they are really looking at the execution of the activities they plan, and they're monitoring the progress, maybe day by day, maybe week by week. And I think this is excellent because they look also at the result of those actions, looking at an outcome, which is Penta 3 coverage and measles. So basically, I would say it's really excellent. It's an excellent success story that I would suggest those guys to write little piece, and it could be in the Global Immunization News. Those are the things that are very interesting for not only us, but all those ones who don't have the opportunity to attend that session. And same for it was in Nigeria, and I feel that I would say in the objective, I would say the objective is not very specific enough, but we realize that at the end, they have some data to share to show the progress from 35 to 73. In objective, we would have loved to see where they started from and where they were expected to be in 3 or 4 weeks and how they get there. So I think this is very important. They illustrate some critical idea like the role model caregivers. I think in any success stories, there are some critical drivers that explain the success story, maybe not one, but maybe 2 or 3. And I think it's very important. They share it here. And we would love maybe to hear more about what they do, those Rodel, how they were trained and what they really did to mobilize the community to make the reluctant mothers or caregivers come to the outreach and get immunized. So more specific numbers, quantified number, because at the end it looked like, a good surprise, but not aiming at. So that's what I would suggest in that one. And I think the fact that you monitor what you have achieved is also an excellent element in your project. So again, bravo for what you have done and you have achieved so far. Over to you.
Thank you very much, Francois. The last word will go to Carolina Danavaro, who not only has found the glove info, and just also wanted to ask her if she wanted to comment any of the anything that she heard today as she was able to join us. Carolina? All right, maybe she's not able to speak to us. So she says gloves not needed unless skin of recipient is not intact. Go ahead, Carolina.
Yes, I'm able to speak, but I was muted. I'm always happy to hear what's actually happening in the field and what people are doing to make vaccination work and to get people access to vaccines. Ensure the right to be vaccinated, no matter how difficult and the circumstances. So I would also encourage you to write a little summary for the global immunization newsletter, as Francois says. It's really important to share what you are doing. I think we normally hear what sort of global organizations are doing, but it's really better to hear how you find solutions that are appropriate to your setting, and this is inspirational. For the glove stuff, I'm going to send a link where you can find the WHO recommendation. Thank you.
Great. Thank you, Carolina. All right. So you know what is going on. You've seen this information before, but it's worth repeating and sharing around you. So the Ideas Engine Bulletin is Tuesday, Wednesday, Thursday, right, Charlotte? And Charlotte is leading this. So she's inviting someone, a member of the Peer Hub, who has a story to tell. Can share their action plan or can share success stories like the ones you heard today. And these are public. So we hope that the global level staff and Carolina's colleagues will take the time to come in and listen to these voices and the stories and the experiences from the health center up to the capital city. Second is what's coming is the vaccine hesitancy and demand. That will be exercise 2. So if you survived exercise 1, you're going to be ready for this. But we expect even more people to join, given how important this question is for everyone working in immunization today. Teach to Reach Level 2 certification. Many of you are in the Peer Hub. You're also registered already for Level 2 certification. We'll be using a completely new platform to do the pilot conference. It'll replace the General Assembly on the 12th of October for the first time, and then we'll be going towards the annual conference of Teach to Reach, in which the Peer Hub country teams will have a prominent role. Every country team that is well organized and functioning will have its own workshop space to present the work done by the country team in the context of a Peer Hub and beyond. Last, of course, just a reminder, you're right now in the Accelerator Launchpad that will be ending on 16th of October. And what you can expect is to go through this same kind of questionnaire. We'll have a few questions that are different, basically asking you, okay, you said you would do this in 4 weeks. You said you would do this in the next 7 days. How far along are you? What progress have you made? What help do you need? How are you doing? And then we'll be sharing that again on Monday. That's it for today. Thank you, and look forward to seeing you on Monday. Again, there's no coursework, there's no project, there's no assignment. Your focus in the coming 7 days is really on figuring out what actions to take and then carving out the time in your calendar to actually carry them out, work with colleagues, get it done, so you have some more success stories as well as challenges and lessons learned to report back on Monday. See you soon.